Well, right now I'd like to introduce you to a very special guest who's joining us from Denver, Colorado. Now, he works with professional athletes, some of who you know, but I'm not going to say. Please welcome Chris Nissler. How are you?
I'm doing great, thanks.
All right, Chris, tell me, what is it exactly that you do?
Well, I'm a performance-based rehabilitation coach, so I work with athletes, active individuals, but primarily my main focus is elite and professional athletes. So I work a little bit different lens than most physical therapists work with patients, in that everything that I do is kind of designed to get people back to performance, as opposed to where traditional PT is trying to help you be able to put on and take off a shirt without pain anymore, or be able to move without pain every day. These guys, it takes a lot more work to get them back out on the field and performing at this high level, and that's where I really, that's where my practice is really
Well,
focused.
because in your practice, an injury can cost somebody millions.
Oh, yeah, absolutely, yes.
So it's very important that you get these guys back. Have you been using stem cell therapy in your practice?
I have. I've been using it for the past 6 years. I've always said that with my own work, I can get somebody from a biomechanical standpoint about 80% of the way there.
Right.
But they're always limited by that little 20%, which is the patient's unique physiology. And using stem cell and amniotic tissue has really helped to kind of bridge that gap.
Okay, so explain to me, how do you actually use it, and what have you seen?
Well, we use it in multiple ways. I mean, if a patient comes in and they've had surgery, we like to have the doctor use it intraoperatively or immediately after surgery to help with the post-op pain and inflammation. But I have a lot of guys that are just trying to get through the season. I mean, NFL, I mean, it's like going through a major car accident every week.
Right.
And so you have aches and pains and things that build up over the course of the season and it limit their performance. So by incorporating the amniotic tissue into our therapy, we're able to keep them feeling better and moving pain-free and preventing injury in order to get through that marathon NFL season.
So what part of the body do you find it works most effectively in?
Man, I really haven't had too many experiences where I haven't seen success with it. My practice, I see a lot of knees and a lot of shoulders. So I definitely see the results there a lot more often than I do, say, in spines or things like that. But there's never been a point where we've used the product and haven't had the results that we're after. So
now, it's pretty new to the general public. Now, I assume, obviously, as a sports professional, you guys know the very best of the best as it's coming out.
Yeah.
How do you feel about it coming out to the general population?
I think it's great. I mean, it's somebody whose whole life kind of revolves around movement, helping people to move and to rehab in the most or to stay healthy and get better in the most minimally invasive way possible.
Right.
Adding amniotic tissue into a treatment program for just somebody off the street is great. I mean, anytime we can avoid having surgery, anytime we can help reduce pain and inflammation, I mean, it's great.
Have you found that some of your players have managed to avoid surgery because of this kind of a treatment?
Most definitely, yes.
Really?
Yeah, myself included. As a therapist, I'm using my arms, my shoulders, my upper body all day, every day, and not being able to use my arms, I mean, it's my livelihood.
Right.
And a couple of years ago, my shoulder got really angry and was just hurting, and I went and saw one of the surgeons I work with regularly. He did an MRI and said, "I think we have to do surgery on you." Well, for somebody like me, that's catastrophic. If I'm not seeing patients, I'm not earning a living. And so I went ahead and had the injection done, and over a course of 2 weeks, my pain was almost completely gone. About a month later, all my symptoms had resolved, and about 6 months ago, I actually went in to get a follow-up MRI just to see how it was doing, and all the symptoms, all the issues that were showing up in my joint when I went in for my original MRI had completely resolved.
So you didn't do surgery?
I did not, no.
That's a pretty big claim that you're making. What
Absolutely.
did your surgeons say to you?
It's funny because they feel a little threatened sometimes, that you're dipping into their business, or that they might not, that's a patient that they would see otherwise that now all of a sudden they're not getting to treat.
Well, but I would also hope that, when you take that Hippocratic oath, that you say, if I can get you better and not have to cut you open.
Well, and that's really it, and that's where we've really seen the big difference in their practice and in mine, is that if you're the person that is able to help these patients to avoid surgery when it may not be necessary or when they can go a little bit longer, you build that long-lasting trust with your patients, and they know that, God forbid something does happen where surgery it has to happen, it's not an option. They're going to come see you because you help them through their issues previously in the most minimally invasive way possible.
We're not talking about no surgery, but we're saying that there's alternatives, from my understanding, having done a research with a lot of surgeons, that before, during, and after surgery, you can introduce amniotic tissue and it makes a huge difference.
Oh, absolutely, absolutely. A few years ago, we had 2 players that had Achilles tendon repairs within a couple of days of one another, and one of the surgeons used the amniotic tissue in the operation, and the other did not. And it was a great study for us to kind of see how these guys responded, because
Really?
it was, aside from different surgeons, it was the same rehab people. They were going through the same protocol. They were in the clinic
wow.
the same days. And when we had one patient completely out of a boot and moving around and able to bear weight, around 4 weeks, we had another patient that was still in the boot and having an incredible amount of pain. So we're able to see this stuff.
Wow. All right. So what would you say to doctors who are listening, who may not know about amniotic tissue therapy?
Yeah, I think it's a great way to enhance the patient care that you provide, whether it's in an operative setting or whether it's something that you would do in lieu of a cortisone shot or some other kind of minimally invasive treatment.
Right.
Especially on the minimally invasive side, I've found that amniotic tissue kind of moves you from a Band-Aid type fix where we can pop cortisone in and it may stop hurting for a while, but the issue is still there.
Right.
To using amniotic tissue where you're actually helping to fix the root cause of the problem and not just cover up the pain.
Which brings me to an interesting point. What is your belief about what amniotic tissue does in the body?
Well, I mean, I think there's a lot that's we're still trying to figure out about it, but what I can say that I've seen over and over and over again is, in terms of quality of life, pain reduction, inflammation reduction, there's nothing that I've seen that does as good of a job as amniotic tissue does. And what that, for me, it really enhances my practice, because if I can get somebody to move pain-free, reduce the inflammation in there, then I can go in and do my job and get them strong and help their body to heal. And they're more motivated to get up and do the work that they need to do and kind of carry their end of the agreement there too. So
it's, to me, having found out about this, it's fascinating, because my understanding is that it does do regenerative things. Literally, like when it comes to cartilage or tendons, obviously things that are not completely torn off, but that it can repair things. And then I think the crazy thing about stem cells is they seem to know where to go and what they need to do.
Sure. Well, I mean, the body is constantly sending signals throughout the body, throughout your nervous system, saying this is what we need, and kind of playing traffic cop and recruiting the right things into the joint.
Right.
So I've always described it to my patients as a way of kind of supplementing and kind of giving a supercharged amount of the things that are already found in your body, but they decline in concentration and viability with age. So we kind of give a supercharged amount of those growth factors and stem cells and all these other things that are found in the amniotic tissue. And you're just giving your body more tools to do its job.
So I would venture to say that, given that you're at such a professional level and you see these great results, what would you say to somebody who's like your mom or dad, who's listening going, wait, what would it do for me? What would you say then?
I mean, I've always said that if we can get somebody who's going out and playing NFL football every week and getting beat up over and over and over again, if we can get them back to a point where they're performing at that high level,
right,
then for the rest of us who are just trying to go out and go to the gym or be able to go for a walk and not feel pain,
right,
it's a lot easier. It's not quite as much work to get somebody like us back up and doing the things we love as it is to get an NFL player back out there.
So is it safe to say that you could actually stand here as a professional and say, yes, it does reduce pain?
Absolutely.
See, that's a huge claim to hear, and I know that you've witnessed it. How many patients do you think over 6 years?
For the past 6 years, probably done a little over 500 patients.
Wow. Any negative side effects?
I've never had one negative side effect. Not one. I mean, when you look at this, it's all natural. There's not a bunch of additives or anything like that. Cortisone has always worked very well, but one of the things we know is that if you put it in load-bearing joints, it can cause those tendons and the connective tissue to become brittle over time and put you at greater risk. There's nothing like that with amniotic tissue.
Wow.
So it's really remarkable in terms of all the things the results that you can get out of it without the risk of negative side effects. So.
Well, and I venture to say that you came all the way here to talk to us today because it's important. I think this is a medical breakthrough.
Yeah, I would definitely agree, and it's I've spent the past 6 years of my life kind of waving this banner and showing people what it does. I've seen such great results with it. It's something I'm very passionate about. I mean, the thing that gets me out of bed every morning is having my players call me, text me, and say, "You wouldn't believe how good I feel. I mean, I'm out moving around, like was able to throw today and didn't have any pain." I mean, that's the stuff that really, that's the reason I got into this. And so to have something like this that kind of helps to enhance, it makes me look better as a practitioner, and it creates, I mean, it creates this loyalty with your patients where, you know, they trust you implicitly, and if you're the guy that's able to help them keep moving and keep doing the thing that they love.
Oh, maybe we shouldn't have said this out loud so the other opposing teams don't know.
Yeah. At this point, there's so, I mean, I work with players on probably 15, 16 different NFL teams now. And there's tons of people like me around the league that are working, you know, with all the other guys too. So
I'm just kidding.
You'd be hard pressed to find somebody that hasn't done it in professional sports at this point, or isn't at least aware of it.
Well, I wasn't aware of it, and I don't know that many of my audience was either. And until I sat here, and I'm going because I have a problem with my knee, and I'm very excited to not be in pain anymore. So I've signed up.
Oh, good.
I know. It's like, but I didn't know about this, and in fact, that's not fair because I'd heard about it for the last couple of years, but I didn't believe it.
Yeah.
When you first heard about this, were you a little skeptical?
Yeah, I mean, there's always that kind of snake oil.
Yeah.
You know, the sirens kind of go off, and for me, it's always, you know, throughout my career, throughout schooling, I mean, it's all been show me the data, show me, you know, give me proof. And unfortunately, you know, at least when I started in this, there wasn't a lot. A lot of it was anecdotal, and so it took us kind of going out and kind of taking a leap of faith and seeing what happened.
Right.
And I mean, at this point, you know, I can say with as many patients as I've seen treated and treated over the years, there's absolutely nothing that would convince me otherwise that this is just not very viable, great minimally invasive treatment solutions. So.
Well, and I think, you know, lastly, we'd heard about, you know, stem cell, and there was some controversy in the 80s about cloning sheep or whatever it was. This is not that, correct?
Correct. Yeah, it's. I mean, this is tissue that would otherwise be medical waste. You know, so in terms of ethical and moral implications, I mean, there's really nothing there.
Right.
So when you take something that would otherwise be thrown away and you're getting these great results from that, I think it's kind of a no-lose situation there. So
it was an awesome time getting to hear from you. Is there anything else you'd like to say to our viewers?
This is something I'm very passionate about, and it's something that if you're really looking for if you've got these chronic issues, you've got an acute injury that you're trying to work through, I would highly encourage your viewers to check it out because it's something that has made a tremendous impact on my patients, on myself, and I think it's something that they could see benefit from too.
Chris, I want to thank you so very much for your time, for your passion.